What's up, folks? This is Jacob Sipkin coming at you from TZHQ here in Southern California. Today we're going to talk about a really important subject, whether you're coaching competitive athletes or general population inside of classes. It's a sort of core concept within CrossFit and similar methods, and it's scaling. It's making our training universally available to athletes of any level. So the first thing we need to do is we need to answer the question, what is the purpose of scaling? And this may seem obvious, but a lot of the time it seems to me that people treat scaling as if it's just there to get people through the workout. But in reality, it needs to be a lot more targeted and precise than that. So the purpose of scaling is to preserve the intended training effect of a given workout for an athlete who would not successfully elicit that training effect if they performed the workout as prescribed. So this means a couple of things. Most importantly, it means that in order to scale effectively, there are a lot of things the coach needs to know. First of all, there's at least two things the coach needs to understand about the workout. Number one, they need to understand the intended training effect. Okay? There's three main parts to this. The coach needs to understand what the intended intensity of the workout is, what the intended duration of the workout is, and what movement patterns the workout is meant to develop. So intensity obviously has to do with heart rate. It's going to be correlated to a lot of different factors, but it's basically how fast you can expect the client to move through the workout. It's going to be relative to the duration. So a maximal intensity effort that's 20 minutes is going to be very different bioenergetically from a maximal intensity effort that's 3 minutes. But the intensity can be relatively gauged according to the duration. Movement patterns are things like vertical pulling, horizontal pressing, hip hinge, knee flexion. So knowing what type of patterns the athlete is meant to be training within the context of the workout. It can also be expanded to include things like total systemic stress, how much should this workout take out of the client overall, and total local stress, which would be how fatigued should the client end up being in a specific area of the body, specific muscle group. Those things are a lot more granular and not really necessary to having a good understanding of the intended training effect. So that's the first thing the coach needs to understand to scale effectively. The second thing the coach needs to understand are the general limiting factors of the workout. I mean general. When I say general, what I mean is that these are the limiting factors by design of the workout, not because of the client's particular limitations, which we'll talk about in a minute. If you happen to watch a video I posted, I think last week, about how workouts can be defined in terms of gears. Gear 1 is a workout limited by the difficulty of the movements. A Gear 3 workout would be limited purely by the client's endurance, and a Gear 2 workout is somewhere in between. So in order to understand limiting factors, having some kind of insight into a structure like that can help. It also gets more granular when you look at specific movements or movement patterns. For example, if you have a workout that has double unders for small sets, but also deadlifts with 400 pounds, that deadlift is obviously going to be the most limiting factor of the workout for most people. Bioenergetic challenges, the actual endurance components of the workout, also help to describe the general limiting factor. It's helpful if the coach understands the context of the workout within the larger program, but it's not necessary. It's very difficult, first of all, for any coach who is not the actual writer of the program to understand the context in full. And the further the coach is removed from the original writing of the program, the harder it becomes. However, it's not really that important, because if the workout is written in a way that the coach is able to understand the training effect and the general limiting factors, they don't really need to understand the context within the greater program, because the context is preset by the way the workout is designed. Now, so that's the sort of general things, the things that the coach needs to know about the workout. There are also things that the coach needs to know about the athlete for whom they're scaling. So first of all, there's individual limiting factors. These are going to be things that preclude the client from achieving the desired training effect that are the client's own individual limiting factors. And these obviously are a lot more varied than the limiting factors of the workout itself. They can be things like strength, endurance, power, technical proficiency, even in a workout that isn't a strength workout. If you have a client who has a 225-pound deadlift and the workout calls for deadlifts at 185, perhaps it's supposed to be a really fast, light workout. We're going to use a workout like that as an example in a minute. But for that client, the limiting factor is their strength. So it can be strength, endurance, power, technical proficiency, whatever. Psychological factors can also play a role. And the two biggest ones, I think, are fear and frustration. So a classic example of fear precluding a client from achieving a desired impact in a workout would be box jumps. If you have a workout in which the client is supposed to be moving quickly, getting their heart rate high, progressing through the movements at a fast pace, but one of the movements is box jump, and the client is really scared of box jumps, and they're going to stand there and stare at the box for minutes at a time, then that fear, that psychological factor, is precluding them from achieving the desired training effect. Frustration is another great one, where you might have a client who really struggles with burpees, for example. Maybe it's somebody who's overweight, maybe they're simply deconditioned. Sometimes you have somebody who's just not in great shape. They're okay, but they're very tall, and burpees take a really long time. And the frustration can get to them. And it can actually cause them to slow down. They see people passing them, they feel in their heads they've already decided, oh, burpees are a weakness. And there's definitely times and places to try to deal with and get past these fears and frustrations, but you may not always want to sacrifice the desired training impact for that within the context of a particular workout. Something else that's important for the coach to understand in both sort of general and specific ways, generally more specific, are potential risk factors. A client may have a particular injury they're dealing with or a history of injury that's relevant to the workout. There are going to be potential injury risks as they pertain to the limiting factor of technical proficiency. So if you have a client who you know their back may be fine walking around, they don't have any back pain, but you know they can't sustain a good solid back position doing high rep deadlifts, that's a potential injury factor. And of course, one is simply their level of work capacity and volume tolerance. Sort of the classic example here is GHD sit-ups. If you have a client who doesn't have the capacity to tolerate a bunch of reps, maybe they can do them, but they won't recover sufficiently, and they're just wrecked for a week. But it can happen with any kind of movement. So these are all things the coach should be aware of. So once you're aware of the intended training effect, general limiting factors, and then also have in mind the client's particular needs, now we can scale the workout. So here's a simple example we're going to use. Take a workout that's 21, 15, and 9 reps for time, deadlifts with 185 pounds for men, 125 for women, and bar-facing burpees. We can estimate the duration here is desired to be 5 minutes or less. This is a fast workout. You should be pushing the pace really hard. We can therefore estimate that the intensity is going to be very high because the client's supposed to be moving through the movements at a high rate, at a fast rate, and pushing the heart rate up. As far as gear goes, we could estimate gear 1, 2, or 3. I would say this workout is going to be somewhere between 2 and 3. The movements, particularly the burpee, are pretty challenging on their own, but the thing that's really going to get to the client, if they're executing the workout in a way that matches the desired intent, their heart rate's going to be really, really high, and it's going to really hurt to get into the next rep. So what are some potential cases that we could scale for? Let's say you have a client with a max deadlift of 225. Now, for many athletes, a 185 deadlift is just not that heavy. Even if your deadlift, say, 315, which isn't huge, but it's strong enough that you're going to move 185 pretty easily. But 185 for a client with a deadlift of 225 is over 80%. So they may well be limited by their strength and find themselves unable to move at the desired rate. So very simple case, strength's the limiting factor. We can successfully preserve the intent of the workout by simply reducing the load. Another situation that's a little bit more complex. Maybe you have a client who's plenty strong, but their positioning on the deadlift isn't great. They start to round their back, maybe they're not flexible enough to get into a good position at the bottom. So we don't want to have that client performing a bunch of high rep deadlifts with their back rounding, losing position. We're putting them at risk for injury, and we're ingraining poor movement patterns. But we want to sustain that hip hinge pattern. We want to tax the back and the hamstrings and the glutes. So what are some good exercises? Now, instead of scaling the load, we're going to change the movement. Good options that I would go with might be deadlift from an elevated surface. That's going to allow them to still train that hip extension pattern, but pull from a higher position so their flexibility doesn't limit them. I actually like Romanian deadlifts, and I might tell the athlete to slow down a little more than they would for a regular deadlift and focus on getting a good stretch in the hamstrings and maintaining their positions. But it's a great way to get some eccentric loading, and that's going to help strengthen the client's back position. You can also just watch the client perform the movement and give them a distinct end point. Tell them, go right below the knee. That's as far as your flexibility is going to allow, or wherever it is. You might go with something like a kettlebell deadlift or a dumbbell deadlift with the dumbbell rotated so that it's vertical. You can lift it off a block. But basically, you're just changing the movement to say, how can I sustain this hip hinge pattern while putting the client in safe positions? So those are some potentialities for scaling the deadlift. Now, what about the burpee? There's going to be a couple of cases where the burpees are really taxing movement for clients. They can't sustain a high rate on. They're basically all going to come down to some type of effect on their cardiovascular conditioning. So if you have a client with very poor cardiovascular conditioning, burpees are going to be super taxing, and they're going to be unable to complete the workout at the desired intensity. There are a few ways to deal with this. Number one, we can just reduce the reps. So we could reduce the reps on both movements or just on the burpee to, say, 15, 12, 9. You could do 21, 15, 9 deadlift, 15, 12, 9 burpee, or 12, 9, 6, or 9, 6, 3, whatever is required for the particular client. It's a simple way to maintain the intent of the workout because the client won't be getting bogged down doing the movement that's reducing the intensity, reducing the rate of the workout. Another common case that burpees are a very tough movement for overweight clients. My favorite way to adjust the movement is to go to a squat thrust, where the client places their hands on the ground, kicks their feet back, so they're essentially in a push-up plank, then bring the feet back up. Another thing that might be a problem with an overweight client, or even just a deconditioned client, is that the coach may deem that jumping over the barbell is not safe. So we can scale the movement to a squat thrust plus step over the bar, rather than a bar-facing burpee, so they're stepping instead of jumping. And from there, they can further scale down the repetitions to meet the client's needs and keep them getting the desired intent out of the workout. So guys, that's scaling. I hope this is helpful. If you have any questions or comments, please feel free to let me know. And if you have other topics you'd like me to discuss, you can let me know in the comments, or feel free to send me a message or an email. Thanks for listening, guys.